UNTAMED TV watchers, thanks for joining us today. We're talking with Dr. Lance Bryce, who is a general surgeon up in the Brigham City area, and today we're talking trauma. I know every time you watch this, you think it's trauma, but this is actual. this is actual trauma surgery, which is something you've done a lot of.
A lot, yeah.
A lot of. Let's define it. What is trauma surgery?
So trauma surgery is basically the surgery that we do in an acute setting associated with injury.
Okay. Bad injuries.
Bad injury. Well, it could be minor injury. I mean, right. Trauma, if you amputate a finger, obviously you're not going to die from that, but it's pretty traumatic.
Sounds like trauma to me.
Yeah,
Sounds like really trauma. Of course, to me, a hangnail's trauma. Correct. I mean, I'm that kind of guy. You know, that kind of thing. But we're talking about serious things, like you say. You're not going to die from losing a finger, but it ain't going to be fun.
That's right. Yeah, car wrecks, stab wounds, gunshot wounds, burns, drownings, hangings. Right. Those kind of things.
Right. And you've seen a bunch.
I have.
Right. Car accidents.
Yep.
Pretty nasty stuff.
Yep.
55 miles an hour. It doesn't have to be 55.
It can be low impact, but if you're on blood thinners, you've already got a fracture of some sort, and you have a low impact injury. Our number one trauma, by far, is ground level fall.
And that seems so strange. I know some of you out there are turning up the volume on your set right now because you're like, what? Trauma from a ground level fall? Yeah. You're talking about someone who's not on a ladder, ground level.
They're walking along, trip and fall over something. They're with their walker, they fall, slide on the snow. I mean, we've got a lot of snow injuries, ground level fall, especially if they're on anticoagulants, which means blood thinners.
So that can be a trauma.
It's a big time trauma, and we've had people die from just that thing. And
we're not talking about just old people.
That's
Kids
right.
on rollerblades, skateboards.
That's right.
All of that sort of thing.
That's correct.
Right. So you get the call as a trauma surgeon, you're home eating spaghetti or something like that, and all of a sudden there's this call and you need to come in.
Correct.
So what's the first thing you do?
I try and call on my way in to see what I'm up against,
Okay.
So is it a gunshot wound or what are we dealing with? So I can start to prepare. And then the other thing that I'm trying to decide is, are we going to keep that patient at our facility, or are we going to get them to a higher level of care? If we're going to keep them at our facility, do I need to get the OR team scrambled so that they can be in and stand by just in case I need them?
Right. And when you say our facility, you're talking about Brigham City Community Hospital.
Correct.
Right. And Brigham City Community Hospital can handle traumas. Is that right?
Yep. We're the number one level 4 trauma center in the state of Utah.
Wow. So what does level 4 mean? What is that?
So level 4, so there's different levels, 1 through 4. A level 1 trauma center, they basically have everything, and they do research. Okay. A level 2 center is they have everything, meaning capabilities, orthopedic, neurosurgery, cardiothoracic, etc. But they don't do any research in trauma. A level 3 has different capabilities. They may or may not have a neurosurgeon. They may or may not have a trauma orthopedic surgeon. And then level 4, we're the front line. We're the outpost kind of thing. So trauma happens everywhere. I mean, we have I-15 running right by us, and we get level 1 traumas all the time. And those are based off of criteria. Our job is to get them there, get them stabilized, intervene in life-threatening situations. If we can take care of the patient, we take care of them. If not, we get them to a facility that can. Okay.
Well, aren't all ERs or Instacares, aren't they all trauma centers, basically?
No.
No.
Absolutely not.
Yeah.
Especially not urgent cares.
Right.
Not even close.
Right. So just because you're an ER does not mean that you're a trauma center. You've obviously had to go through some sort of program and criteria to become a trauma center.
Absolutely. There's definitely criteria for that. We get audited every 3 years, and it's a very rigorous process. We do process improvement. We actually have to look and see what our cases are, how did we handle them, what's our mortality rates. I mean, this is all public information that the state of Utah comes and grills us on, and we actually really enjoy it because you get to a point where you think you're doing everything that you need to do, and then you get this outside opinion. Hey, why don't you try this? Or why are you guys doing it this way? Consider doing it this way. So we actually love the visit. we think it's very helpful to our program.
Kind of brings it all ahead to you. So, I mean, bottom line is, if you're in a traumatic situation, you probably should get to a trauma center if you can.
Yeah, closest one you can get to.
Right, right. Okay, so then you get in there and you've got to assess what has happened to the person. And obviously trauma, bad injuries to the head,
Mm-hmm.
a lot of bleeding,
Yep.
Broken bones,
Yep.
Heart that's not functioning.
Sometimes not even beating. So.
Right.
Yeah, we have collapsed lungs, broken ribs. You know, we put in chest tubes, central lines, C-collars, those kind of things like that. And again, if we can take care of them at our facility, then we keep them. And there's just a simple litmus test. If that was my family member, would I feel comfortable taking care of them in my facility?
Mm-hmm.
If the answer is no, we move them.
Out they go.
And we don't have to go by all this scientific criteria. There's just some things that you know that are not scientific, but you got a gut feeling. You say, yeah, I really think we should get this patient, you know, to a higher level of care.
Somewhere out
Somewhere
there.
else, yeah.
So then you get to work. You and your team get to work and do what you can to save this person's life.
That's right.
Right, whatever it takes.
Yeah, sometimes we go directly to the OR. Sometimes, you know, we put a tourniquet on and get the bleeding stopped and build their blood levels back up. But usually by the time we get that to that point, we have a helicopter there we'll take them to a big center.
So as a trauma surgeon, you stop the bleeding?
Bleeding is the number one cause of death in trauma.
Right.
So.
Right, or whatever it takes to make that happen.
Yeah, there's a huge campaign that's coming out right now called Stop the Bleed. It's going to be the CPR of our time. So we're actually teaching classes. We'll be teaching them for free at our facility at Brigham, and anybody from the community can come up and actually learn how to stop bleeding. It's literally designed for the second grader to learn how to stop traumatic bleeding.
I could learn it.
Yeah.
I mean, that's how simple it is. Craig Bielik could learn this.
Yeah. It's not hard. It's put pressure, and if you have a tourniquet and you know how to use it, then we teach people how to use it. So.
I remember that stuff from the Boy Scout days, and which is good advice.
Yeah.
And stop the bleeding, treat for shock, all
That's
of those
correct.
kind of things.
Yeah. We don't put the legs up anymore or anything
we
like
don't?
that. No, we don't do that. They've done some scientific studies. It really doesn't help. We thought, it would send the blood back to the vital organs and everything. It really doesn't help that much.
Oh yeah, boy, I remember that from the Boy Scout days. Yep. It's been a while since I was a Boy Scout.
Yeah.
We
half
don't have a century.
Yeah, we don't have any problem with them laying down or anything like that, as long as it's not compromising their airway.
Right.
But we go through what's basically called a primary survey: airway, breathing, circulation, deformities, and exposure. And the American College of Surgeons Committee on Trauma is thinking about putting an X up before the A, which stands for exsanguination. So if you're trying to get someone's airway open, but you notice that their femoral artery is pumping, pints of blood per minute, you probably better go stop that. Priority. Because you're not going to get enough oxygen on an airway unless you get that stopped.
Wow.
So. Wow. And we're getting all this from unfortunately we have wars, but we're getting some great information out of the wars on how to stop bad trauma.
Coming through that.
Absolutely.
Right.
Yeah.
Right. So Dr. Bryce is a really nice guy, and I would encourage everybody out there to meet him, but don't meet him in the trauma center. So how do people stay away from you in the trauma center?
Don't do stupid things. We always say don't stop. You can't stop stupid. So wear your bike helmet. Wear your seatbelt. If you are working with a firearm, know it's safe use. If you're working with a bow and arrow, know it's safe use. If you're out on the water, make sure you wear your life jackets.
Right.
Those kind of things like that, and make sure you don't go do things on your own all the time. So even simple things like hiking can get people into trouble if they're by themselves.
Nowhere, just like say, don't do something stupid.
Yeah, don't do stupid things.
On that kind of thing. Let's talk for just 2 seconds about gun safety.
Sure.
I mean, firearms are popular here in Utah. Mm-hmm. We're the West, after all, and
I'm pro-gun.
Okay, there you go.
I'll just tell you right now.
He's pro-gun right there.
Yeah.
He's packing right now.
Yeah.
I can see he's got a bazooka on him.
Yeah.
No, not actually not. But what do you do with them? I mean, I think most Utahns know how to handle guns, but there's probably people out there that think they know, but they're making small mistakes.
Yeah. So if you see a gun and you literally have never handled one, don't make that your first time. That's a simple thing. You know, one of the big things that's happening in our country right now is active shooters. You know, we're seeing an increase. We do all these fire drills at school, and we haven't lost a kid in a school fire in over 50 years. But we're losing people in active shooting situations. The only scientifically proven thing to stop that kind of violence is a good guy with a gun going to stop the bad guy with a gun. There's no other scientific way. There's no nice way to ask them to not do these things, etc. But, you know, guns prevent somewhere between 800,000 and 2 million violent crimes a year, which essentially would come down into the trauma realm. And they're prevented by someone just absolutely knowing how to use a gun, how to use it to protect them. They may never have to fire a shot, ever. But there's an instance of the gentleman up in Oregon when they had a mall shooting, and he just happened to be walking into the mall with his girlfriend and her sister, and sees a guy, and he was shooting, and all the guy did was draw down with his gun, and the guy saw him with the gun. He grabbed his stuff, went over into the elevator shaft, and killed himself, which was what he was going to do anyway. But he stopped this violence, and so the government, you know, should really get into this, because what other program prevents that much violence, where you get the citizen to pay for their equipment, pay for their training, and even buy licenses that are required by the government? In some instances, it actually makes money for them. So to me, it's one of the great prevention programs in trauma. And you can say what you want to or how you feel about it. If you don't like guns, that's perfectly fine. But they do prevent trauma.
And that's what we've been talking about, is preventing trauma. You've got to prevent trauma. Don't do stupid things.
Don't do stupid things.
Wear that bike helmet. If you don't like the way that it looks, gussy it up, paint it, you know, glue a dinosaur to it or something like that. Wear your life vest when you're boating.
Wear your seat belt.
Wear your seat belt. You know, I'm always surprised when I hear of an accident and they say the person was not wearing a seat belt, and I'm like, who is this person? Everybody wears seat belts. Everyone.
Yeah. Motorcycle riders, please wear your helmets. For whatever reason, motorcycles are invisible on the road.
Please.
It's like they have a cloaking device, you know, and you can't turn it off, and people just miss motorcycles.
Right.
And I've had several discussions where I have to go out and tell families, your loved one is going to die, and the only injury they have is a brain bleed. Everything else is perfect. And it's the saddest conversation in the whole wide world.
I can imagine. I don't think a lot of us realize how fragile and vulnerable our noggins are.
That's right.
And you can find yourself in a lot of trouble with just a slight bump on the head.
Yeah. Oh yeah.
Slight bump on the head. So do it. Stop doing stupid things. Wear those seat belts. Wear those helmets. Don't go see Dr. Bryce in the trauma center.
Please, yeah.
But do see him if you need things like gallbladder removal and things like that. And you can find more information at brighamcityhospital.com. And you lucky folks, you joined us for Untamed TV today with Dr. Lance Bryce, General Surgeon in Brigham City. Thanks, and join us again.